Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Neostigmine. Neostigmine is a quaternary amine and it is a ganglion stimulant. Neostigmine is a quaternary amine and it is a ganglion stimulant followed by a blocker. It can exhibit sympathomimetic effect due to ganglion stimulation. The neostigmine is the drug of choice for cobra bite. It is used in the reversal of neuromuscular blockade. It can be used in myasthenia gravis or post-operative paralytic ileus and post-operative urinary retention. These are the main areas where neostigmine is used. Neostigmine is the drug of choice for cobra bite, for reversal of neuromuscular blockade, myasthenia gravis, post-operative paralytic ileus, and post-operative urinary retention. Neostigmine is contraindicated in intestinal obstructions.
thank you and thank you for watching.